beautiful song. This is Poka Lainu. You are listening to Hawaiian Potpourri. The time now is 33 minutes past the hour of 6 o'clock on Sunday, the 9th day of September. We do have a telephone caller, and our telephone line number is 524-1080 should you wish to call and join in our discussion. Let's go to our telephone line. Aloha caller, welcome to the program.
Good morning, Poka.
Good morning.
I fear I might be haunting you.
No.
But as victims, we've always heard, you've been asking for it. I do appreciate your approach to those who are called mentally ill very, very much. I've had sort of a bumper sticker phrase on my mind for years, and it's people, not pills. And I think that you have adopted that, or you're using that idea very, very well, beautifully, because you're doing exactly what I thought was needed in cases like this. First, I'd like to ask for a definition of mentally ill, and then yes, you've already answered the question of how you go about I don't even like the word treating. So perhaps we could choose a word like interacting, because in my experience, when I used to walk, when I didn't have a car, I used to sit at the bus and speak with a lot of, not a lot, but several homeless people, and I found that they knew the political situation much better than the average person does, because they've experienced it. And so they found, I think, no way to adjust to the situation without being called mentally ill. They just could not function in it any longer. And perhaps they didn't even know the reason why, but they just could not do it. And that was my experience. And this was especially true among men. The women I had spoken with seemed to be almost in a daze, because one can only imagine what it's like for a woman to live on the streets.
And sometimes it may not be in a daze, but it may be a way of avoidance, because especially when living on the streets and where there is no appropriate bathing facility or toilet facility, and where they are shunned from using a bathroom in a restaurant or things like that, they just don't know how to accommodate for the natural needs of that human person.
Yes, these are tremendous problems trying to exist, not live, but even to exist. Yes, it must be a terrible shock to find themselves.
I had a friend. She became a friend after I did some interviews with her, and this was before I even got into the field of mental health. And this was a woman who had been a social worker and was injured. And as a result of her work injury, she was not able to continue with her housing as well as her medical services. She went on workers' compensation, and but it didn't pay for all of the other expenses she has. She eventually lost her job. She became homeless, and so she was able to relate to the difficulties from a very vocal way of expressing. At one point, she was on the other side providing these services, and on the other point, she saw it from the side of those service providers. Just by being homeless, it can drive you into mental illness.
Oh, absolutely.
Yeah.
Well, what we call mental illness, I guess, which is the inability to function in your life, and that always occurs.
It comes back
degrees.
Yeah, it comes back to your question. How does one define mentally ill?
Yes.
And I've worked in the area for many years now, although I'm not a direct service provider, but I've worked as the more in the administrative side. But then I still need to have some knowledge of that direct service. And generally, the way I would define it is, you're okay unless this particular illness affects your normal daily activities. For example, if I'm engaged in a conversation with you, normal daily activity, and then I begin to hear voices that interfere with, and I am not able to stop that interference, so that it becomes an interference with my ability to converse with others. And so I'm conversing with the imp in my mind, or whatever it is.
Yes, and that's an impulse, by the way.
The imp, for impulse. Have you read Edgar Allan Poe's The Imp of the Perverse?
No, I haven't. I've been busy trying to follow one of your previous callers' poem about the tree, and I found the poem, and I stopped at the first sentence because I could see how this person related. But it's distant now, and I don't have the details. But I haven't read Poe's other poem. And what was the name of that again?
The Imp of the Perverse.
That's an excellent word. I've thought of it for years because it's really impulse that's not controlled. You know, we talk to little children who do something mischievous. Oh, you little imp, you.
Yeah.
He's following an impulse. The child is following an impulse. So we have to clarify our usage.
Yes, and what Poe is saying, that even if you can control it, the imp still exists.
Yes, exactly. And how far it's suppressed, and how seriously that suppression or oppression has on your impulse it could be detrimental to your health. And that goes, I can take it back to the Bible, but I won't do that right now. We got to stop someplace. But I did want to ask a question or make the statement that I think drugs, whether they're legal or not, or illegal, are used to alleviate pain. It's mostly psychic pain in this case, I think, and that alcohol and any other drugs that people disapprove of are being used to a great deal to alleviate psychic pain. I think it's easy enough it's not really easy enough to get a serious pain relieved through the medical system. All they want to do is give you a mind-depressing drug. Even if you get a bit anxious, they say you want a Valium. I mean, that was done to me, and I became furious. That stuff is just passed around like candy now. Used to have to go through a psychiatrist. Now the regular doctors, I don't like to use the word regular, but the doctors we meet, I don't want to insult everybody, just hand it out. They have the privilege of using it, and it's become, I think, indiscriminately But your solution of people using people, because I think, and you know more than I do about this, that people can only help people and not some drug.
You have a continuing debate on that issue. But before getting into that point, I think there was another question you asked, and that was, what do you call them? We call them patients. We call them clients.
Yes.
We call them by their names.
We even call them homeless.
We even call them homeless, yes. We need to recognize that mental illness is a disease or is a sickness. It is no different from diabetes. It is no different from back injury. It is no different from an illness that a person goes through at a particular time. But you don't identify the illness as that person or as that client. And this has been a battle that those who suffer from mental illness have been trying to fight. And they are essentially saying, look at me as a human being.
Right. But now, Poke, if I might intrude this idea, which I've been experiencing on a deep level, I've been listening to lectures by Sapolsky, who is a neuroscientist, that these conditions, even hearing voices, are the result of impacts on the nervous system, actual anatomical changes that have occurred. And I mean, I think this is that the person has been subjected to something so serious that, and now all of us have in the socialization process actually, been subjected to an input that is overwhelming to his system and has made sort of indentations on the nervous system and the transmission of information. And this hearing voices is a result of that, and that the person really on his mental state is hearing those voices.
Yeah. For us, our approach is this, and what you are now describing is somewhat similar to, but not exactly, with what came out of this organization known as SAMHSA. It's a federal government organization that stands for Substance Abuse Mental Health Administration. And they control a lot of the monies that come to states, and they define what is appropriate practice and what is not appropriate practice. What they call evidence-based practice for them is what the appropriate practice is. And they had come out with dollars for what they call an evidence-based practice that was called Illness Management and Recovery, or what we call IMR. Based on this illness management and recovery, the essential theory is the following: that a person suffers from mental illness because there's something occurring in the brain, and oftentimes it is because of the kind of juices that get shot out, the serotonin and different kinds of stuff. Now, and that will cause depression, that may cause schizophrenia, hallucination, auditory, or whatever it is. What is important is that the individual understands that he is in essence a chemical laboratory, and in order to change that chemical reaction, you use medication to change it. But his knowing it is important, because now he knows when to take it, why he needs to take it, and it'll help him to become more, quote, compliant to that medication. The second part of that program is that he also needs the social support around him, because at times it is his interaction with his fellow human being that may affect his chemical laboratory, or it is that association with his neighbors and friends that can warn him and keep him within the acceptable limits, or tell him when he's backsliding or when he's relapsing. So that is a formula. Now, when we received that practice and we were asked to roll it out into the Waianae community, I said we will not roll it out unless we are permitted to make cultural adjustments to what you are bringing in. And so we took up to 2 years in my discussing with my staff, with our consumers, with the general community, consulting with elders in the community. And we said that this is only looking at one portion of the whole arena of what is considered mental illness. Because what you have left out are two other very important arenas, and that is what we call the akua, or the spiritual aspect of mental illness for a lot of our cultures.
I have a question about that later, Pono.
Okay. And the third is the aina, or what we call the environment, the condition of homelessness, the condition of lack of employment, very poor education, and all of those other conditions in which that individual lives within. So it's a context that the individual is within. For example, we asked, where is the first place that generally people will go to when they notice that someone's behavior seems to be changing? They tend now to be talking to themselves, or insisting that someone who had recently passed on has continually comes back and visits them, etc., etc. They are not going to the psychiatrist to talk about these problems. They are going to the elder in the family, or they are going to a church minister, or they are going to a temple. But normally the first reaction, whether it's a Hawaiian group or a Chinese group or a Filipino group or wherever it is that reference. Although they won't talk about it, they won't tell the doctor, and the doctor oftentimes don't have the cultural sensitivity to even inquire. But historically, that's how we had seen it, and we have seen stories over and over and over again. I had a client, for example, who one day he was fine, he was working, he was a hop tool operator, and he was doing very well. He supported his family of about 4 people, and so he was doing very well. Then his boss told him, dig up this grave because we need to move the bones to another place. And he told the boss, I can't do it. He said, I cannot go dig up the grave. What do you think? It's totally inappropriate. So the boss said, either dig up the grave or get off the machine, go home, don't come back to work.
Sure.
So he dug up the grave. The very next day, he kept hearing these voices. And he was considered very seriously mentally ill. He wasn't able to come back to work. He was covered by workers' compensation, but he was our worst cases of schizophrenia. When I got into my position and I found out about this case, at that time it was too late. There was no opportunity to now refer to a kahuna, a kupuna, or to go through ho'oponopono, which would have been the normal practice for a Hawaiian community. But instead, he was being treated by psychiatrists. He was given medication from that approach that he's merely a chemical laboratory.
Removed from his support system, yes.
Yeah, so what I'm saying is that there are so many different aspects to the issues of mental illness that we need to be broad-minded. We need to be willing to be surprised at how wrong our assessments may be. I once had a native Hawaiian person who was homeless, and he kept sleeping over at our facility. So I said, well, rather than having him act as if he had no place to go, I invited him to be my watchman, and please sleep in front of my door. So he
that's very good.
Yeah.
You make him feel very useful, I think. That's
he's going to do it
problem.
anyway, so I guess we'll develop a rapport with him. But then I told him, I got this wonderful program and how we can treat native Hawaiians, and we are willing to look at the spiritual side, the environmental side. And he looks at me and he tells me this. He says, I actually was born in Chicago. I grew up in New York City. That's where my heart and soul is at. Just by coincidence, I'm native Hawaiian, and I came back to be closer to family who could give me support through my mental illness. But I know nothing about the culture. Surprise. My expectation is that he was deeply ingrained in the culture. We're out in Waianae. He's sleeping in front of my door. So the willingness to be surprised and to work with the client, with the patient, and have them really become the leader of their treatment is one of the most important things that we oftentimes at times have difficulty really appreciating.
Yes.
Yeah. Okay, I've talked enough. Go ahead.
Okay. I just have 2 small comments, and I wondered how long did it take you to have your method reach some kind of improvement by those dispensing largesse or grant money?
It took us about 2 years.
I thought so.
Yeah, and we came out with this, but we had already been practicing it.
I know.
But I had to rewrite the evidence-based curriculum.
Yes.
To reflect what the normal practice had been.
Yes.
And then the Department of Health, the adult division, threw up their hands and said, this is a terrific product. Look what we produced. We produced.
Good for you.
And then they talked about exporting it to the Pacific Island territories, so that because
try to export it to the old country, the mainland, the old country. Let's see what happens.
And then what happened is, after that occurred for about 6 months, then the head of the Department of Adult Division of Mental Health retired or resigned, left Hawaii, and then we became the subject of attack
Yes,
by the adult division.
That, yes.
Yeah.
That's why I asked that, because I remember that. And I wondered. Well, in order to allow others to speak, I'll just like to mention one other thing, is that is this topic of drug abuse used in relation to the medical profession, because I see that with the indiscriminate, I wouldn't say indiscriminate, but overuse of the psychic oppressors by the medical profession. And that's just the end of it. And thank you so much, Pono.
Thanks for calling.
Okay.
Take care. Aloha. Yes, and with regards to abuse of drugs, they do occur on both sides of a relationship. Both, as far as I'm concerned, from the medical side, which is overdosing with drugs, and on the client side, the self-medication is one of the abuses of drugs, even when they accept the medicine from the doctor without thinking for themselves. I think that too is an abuse of drugs. So at times, for those people who do not have opportunity to go to for medical care, they self-indulge, they self-medicate to lessen the voices, or they self-medicate for many reasons, and then we call them addicts. But they are addicts, no different from those who abuse drugs that they can get legitimately. They're still addictions. There are ways of taking care of addiction. There are ways of taking and stopping and seeing what really is happening. I've been on diabetes medication for the last about 35, maybe 40 years. Until one guy and I complained about pain in my legs, pain here, pain there. And he says, "What kind of drugs you taking?" I says, "Well, it's ibuprofen for my medicine." He says, "That's why you're getting all these pains. After all these years, you're going to get an effect from it." He says, "Stop taking it, eat vegetables and fruits for the next 30 days, and then we'll see if you're still suffering from the pain." And so I stopped taking it. I changed my diet, increased my exercise. The doctor just shook his head. He thought I was crazy. He says, "You cannot do that. You're diabetic." And so I said, "Well, this is what has been happening." So I stopped it. Then I took my blood test, went to the doctor, and when I saw him, he just shook his head. He says, "You're not diabetic. Your numbers are all within appropriate range. Your A1C is down to a 5.4, I think it was, and that was by not taking the medication." And so this friend of mine, who is a naturalist, essentially says that is what is keeping you diabetic. It's that medication. So I don't know if it's psychological or the body has gotten used to it, but it was by the change in the diet and of course exercise that has to go along with it. And all my other numbers started shaping up. We do have another caller, and my apologies to the caller for not taking your call earlier. Welcome to the program.
Hi, Polka.
Hey, David.
Hey, how's it going? Anyway, I was just thinking about how you were talking about these different labels that they put on people. Actually, like your client, your patient, and that kind of stuff. And down at the homeless shelter, they always talk about the clients, and I correct them and I say, no, not clients. Human beings. These are suffering, needing human beings that need your sensitivity and caring and that kind of stuff. And don't forget that human beings. That's what they are. You need to humanize this kind of stuff. And I get kind of dirty looks.
I like that.
That's what they do. You know, they put to me. Something like a client is like some number or something.
There's a distance. There's a human distance when you use such terms. What CARF, or the Commission on Accreditation of Rehabilitation Facilities, a term they are trying to use more often, and in all of their correspondence, they talk about the person served, and so that's the term of art. And so more often we are beginning to move in that direction. But human beings are essentially the relationship. And you're absolutely
it
correct.
has to be humanized, or else,
Yeah.
Oh, by the way, I'll talk to you later. My bus is coming.
Take care. Thanks for calling. Aloha.
Yeah. Aloha.
And with that, we're going to end that call and make sure he catches his bus, because oftentimes he has to wait for an hour longer or even more, because the bus routes are changing. This brings us to the end of this program.
Kaulana na pua o Hawaii, Kupa ama hope o ka aina, Iki mai ka elele o ka loko ino, Pala pala anunu me ka paka. Pane mai Hawaii moku o ke ave, Koku ana honoa o Pilani, Ka ko'o mai kaua I o mano, Pa'apu me ke one o ka puhi hewa. Aolea e kau I ka pulima, Maluna o ka pepa o ka enemi, Ho'ohui ai nā ku ai hewa, I ka pono sivila a o ke kanaka. Aole makoa e mina, I ka pu'u kala o ke au